Tick season is off to a quick start, and there is concern now about what that could mean for future illness.
So what can you do right now before we really get into the thick of spring and then summer? Kate Chappell is talking with the experts. She's joining us here in the studio. Kate?
All right, Alex, Marion, so we know the CDC is reporting that hospital visits for in the ER for tick bites is up right now, but it's still too soon to tell if that means more disease will be happening as well. Illnesses, tick-related illnesses. They haven't tested the spring ticks yet or published that data. But one thing is for sure, there is earlier spring activity among the tick population, and with more exposure, as with anything, the greater the risk for infection.
I had classic cold and flu symptoms, and that led to a 2-year delay in diagnosis and permanent bodily damage.
Allie Moresco still deals with the long-term effects of her Lyme disease diagnosis 10 years ago. She saw more than 12 doctors before she was even tested for Lyme.
Don't spread Lyme disease misinformation.
Now she uses social media to advocate for prevention and awareness, warning of the dangers of ticks, which are active early this year. According to researchers with the Illinois Natural History Survey at the University of Illinois, they work with the Illinois Department of Public Health on statewide surveillance, collecting and testing ticks for disease.
And particularly American dog ticks seem to have gotten an early start this year. And I think that probably is just due to this very unusually warm March that we had this year.
Hospital visits for tick bites are up across the country, according to the CDC. But experts say it's still too early to say if that means tick-borne illnesses will also be higher.
There is often a lag with tick-borne illness between the tick bite, the presentation of the illness, and the diagnosis of the illness.
Most ticks don't jump and none fly. They position themselves on leaves and tall grasses, and then when brushed up against, can crawl onto a human or animal.
Walking in the center of forested pathways, away from the edges and away from the brush, is the best way to avoid coming in contact with ticks.
Tick-related illnesses can be difficult to diagnose. Dr. Richard Horowitz works with chronic Lyme disease patients and is a founding member of the International Lyme and Associated Disease Society. He says symptoms like what Allie experienced.
And I still do have some days where I wake up and I'm in pain and my joints hurt and my muscles ache for no reason.
Are what you should be on the lookout for.
Good days and bad days where the symptoms come and go. You have fatigue, you have migratory pain, you have memory concentration problems you didn't have before. You can't fall asleep.
All right, so here's how you can protect yourself and your family, most importantly. When you're outside, wear light-colored, long-sleeve shirts and pants. You've heard that. Look for EPA-registered and approved repellents, so things with DEET, picaridin, oil of lemon eucalyptus. Do tick checks every 2 to 3 hours, especially if you're outside for a long period of time. Look on the hairline, back of the neck, underarms. Those are places they like to hide and crawl. And when you get back inside, put your clothes in the hot dryer for 10 minutes. If you do find a tick, this is really important, remove it as soon as possible. Use tweezers, get to it as close as you can to the skin, and pull it up steady with even pressure. That's going to be your best bet to try and get rid of it before it attaches. IDPH does recommend, though, you submit your ticks for testing, especially if it's been attached to you for more than 24 hours. Put it in isopropyl alcohol, then bring it to your local health department. And that way, if you do get sick, it'll help your doctor with any future diagnosis as well.
Wow. That's a lot to remember, but still very, very important. And nobody needs to get the Lyme disease. Poor woman that's been dealing with that.
Yeah, the symptoms
up
for a
and down
long
symptoms.
time.
Yeah.
Good tips. Thank you, Kate.
Thank you, Kate.